Hey everybody, today we're talking about can fibroids be removed during your C-section? I'm Dr. Perkins, a board certified OBGYN, and I'm excited to talk to you about this. And so come on in, join us, let's talk today. By the end of this video, you will know what fibroids are. You will know what the focus is typically during a C-section. We'll talk about the risks and the benefits for removing fibroids during your C-section. And we'll talk about things that you should talk to your doctor about prior to your C-section. And guess what? If you hang out with us until the end of this video, I have a free gift for you as well. All right? Well, what are fibroids? Fibroids are very common and you might even say that they're annoying. And if you do, I agree with you, okay? I have fibroids myself and I'd rather them not be there, but they're here. So, they're part of me. And so we can talk about what do we do with them, especially if you know that you're going to have a C-section. And so what are they? They're called a leiomyoma. In medicine, we often say myoma for short, but clinically or healthcare-wise, we don't say fibroids typically. That's a social word that came from somewhere out of nowhere. But a fibroid is a mass, it's a growth that occurs or happens and is found inside of your uterus. It can range from the size of a blueberry to the size of a melon, even a small watermelon. They can be pretty large. I had a girlfriend who had a fibroid that was like the size of a basketball in her abdomen, taking up all the space, squishing her bowels, her stomach, her pancreas, her liver, everything. Massive. She looked like she was about 8 months pregnant all the time. And once that fibroid was taken out, her tummy literally concaved in, like it just disappeared. And so fibroids can be large and they can be problematic. They can be larger and not problematic. And so it all depends on where they're located and their size. And so they can be found in the inner part of the uterus, the middle part of the uterus, the outer part of the uterus. They can hang off of the uterus. Either way, knowing their details as much as possible is super important. And how do you know this? Well, one, it's important that you see your regular GYN for visits every single year. It doesn't matter if you are 70 years old and postmenopausal or 25 years old and getting regular periods and thinking about fertility. Even if you're a teenager, it's important that you're seen and your pelvic region, your inner female reproductive organs are checked regularly. And so every year is the recommendation. Now, in your exam, we may physically check to see if you have fibroids, or we can use an ultrasound to examine and look at all your organs. And your organs being your pelvic organs, your uterus, your fallopian tubes, your ovaries, all of that can be seen on imaging. If you do have fibroids, and we know this, and we have a current growing pregnancy, which is the core of what we'll talk about today, it's important for us to plan ahead. And so if you're just like, well, yes, I'm pregnant, yes, I have fibroids, and I'm planning to have a C-section for whatever reason that is, you're having a C-section, let's talk about what that C-section may look like. In general, scheduled C-sections are done 1 week prior to your due date, roughly, depending on, if it lands on the weekend. So say, for instance, your due date is a Saturday. Oftentimes, surgeons like myself would rather not schedule these procedures on a weekend. So if you're 39 weeks, which is 1 week before your due date, on a Saturday or Sunday, we may schedule your C-section for the Monday or Tuesday or Wednesday after, okay? But somewhere around that 39th week of gestation. When things are scheduled at 39 weeks, or C-sections are scheduled, to be specific, we know that babies at 39 weeks have gained all the benefits of the womb, of being inside, of growing inside of its mom. Because of that, that's a perfect time to get your C-section done, where we know that babies are not losing out on any benefits of being on the inside. And so we can sometimes do your C-sections a little bit earlier if we have other risk factors that we need to account for. But in general, 39 weeks is a goal. Now, when we're surgically doing your C-section, our goal is to safely go through 7 layers of your abdomen, go inside of your pelvis into your uterus, remove your baby, quickly stitch and close your uterus, and I'll tell you why, and close the other 6 layers and finish your surgery. The focus is on getting your baby out quickly and safely. And the reason is, when you are pregnant, and especially when you are in your 3rd trimester, your body sends a majority of your blood flow to your uterus. Why? Because your body prioritizes your baby. We want to give all the nutrients and all the blood and all the oxygen to your growing child. And so your body would sometimes even sacrifice yourself to prioritize getting blood flow to your baby. So majority of your blood flow within a minute goes to your baby. 100%. And so during surgery, if a majority of your blood is going towards your uterus and your baby, and we're cutting open your uterus, guess what can happen very quickly during surgery? Bleeding. And so we do not want that. And so because of that, as soon as we get baby out of your uterus and we pass and hand your baby off to the pediatricians or the NICU team in the operating room, our goal very quickly is to close that incision up really quickly. And so if I showed you on a model here, this is Ivy, and her smile is literally where we would put or open up your uterus to get your baby out. So as soon as your baby comes out, we start stitching from your left side, literally, almost immediately, so that we can stop the bleeding that is happening because we cut your blood vessels in order to take your baby out. Now, the question of the hour is, can you remove my fibroids during this procedure? Okay? So typically the answer is no. And I'll tell you why. Because the likelihood of you bleeding, hemorrhaging, losing a lot of blood, needing a possible blood transfusion, and possibly losing your uterus because of heavy bleeding and needing a hysterectomy is so much higher because your body is pushing so much of your blood to this one area. Any cut to your uterus will cause bleeding. And do you know that typically your bleeding on average can be up to a liter of blood loss during a C-section? That's a liter. If you think of a liter of soda, for instance, that's a lot of blood. And that's normal in any cesarean section being done across the world, that you may lose that much blood just to get your baby out. And so if you had fibroids that are throughout your uterus, every single time we would cut your uterus to remove that fibroid, guess what's happening? You're bleeding and bleeding and bleeding. And so do we want to do that during a C-section? No, we absolutely don't. And if I wanted to add another variable here, a majority of pregnant women are anemic. So you are starting surgery with lower blood levels than normal. We know your surgery will cause you to have bleeding. And we know that every single cut that we make to your uterus will lead to more bleeding. What we do not want is to cause you harm. And so because of that, it is not recommended to remove any fibroids or other masses from your uterus during your C-section. I know it sounds like, well, you're right there. Can't you just do it? Yes, but your safety is more important, and your recovery from surgery is more important than removing those fibroids. So yes, we see them and we touch them, but we leave them there. There are always exceptions to the rule. And the exceptions to the rules here is that every now and then a fibroid, and I'm gonna just show you both. Sometimes the fibroid can be located exactly where we need to make the incision for your surgery. And so it's recommended that we do your surgery in this location lower down on your pelvis because there's less bleeding and the possibility for blood loss and less uterine muscle there. And so it's recommended that we do the surgery right there. If the fibroid is there, depending on the scenario, we may need to remove that fibroid in order to remove your baby from this location. If for some reason this fibroid, which may come with more blood vessels and more complications. If it seems as though this fibroid is going to be too difficult to safely remove, then we may do your surgery a little bit higher up. And if that's the case, then if you had the possibility of VBACing, which means having a vaginal birth after a cesarean section, that may remove the possibility of that happening in the future with another pregnancy. But if you've always had C-sections and you're probably going to have another C-section, it might not be more risky for you. But in that scenario, your surgeon will then determine how safe it is to remove that fibroid at that time, just for the sake of safely delivering your baby. And so there are exceptions, but the rules overall is to not remove your fibroids during your C-section. Now, I know I talked about the risk of bleeding, but there's also the risk of infections. Each time that your uterus is cut open, which is the only way to get out of fibroid, we must cut the tissue of the uterus open, there's a risk of having an infection. Did you know that fibroids can be infected in and of themselves? And so removing them may increase the likelihood of getting an infection as you heal as well. Again, safety is the most important. As a physician and surgeon myself, our goal is to do no harm. And so we want to safely be able to operate and help you, and not necessarily conveniently doing so. All right, I hope that makes sense. Thank you so much for joining us as we talk about such an important topic today, and a question that I get all the time. A gift that I have for you today for listening in is a copy of my ebook, Hormones Don't Lie. In this, we talk about how to balance your hormones and to decrease the likelihood of having things like fibroids and growing fibroids at that. And so if you would like this, click the link below in the description right below this video, and I'll send that right over to you. Thank you so much for being here. I'm Dr. Perkins again, and I'll see you next time.